Well, as February comes to a close, we're going to try to raise some sight, I guess, for lack of a better terms, on age-related macular degeneration. It's already a very common problem in our population, and it's projected to only become much more of a problem as a lot of us get older. Ophthalmologist Dr. Robert Block is back with us again this morning. Thank you for being here.
Thank you for having me.
Yes, glad to be here. I think a lot of people have heard about cataracts and other eye problems. Macular degeneration, I think, is one of those things that a lot of us have heard of, but I don't know that we know what it is. What is it?
Right. So first, it's the most common cause of irreversible severe vision loss in the United States and developed nations. So it's very common. The macula is part of the retina.
Okay.
The retina is the part of the eye that accepts the light, transmits it to the brain, and then converts it into the images that we see. So what macular degeneration does is there's two forms. There's a dry macular degeneration that accounts for approximately 80% of all patients with macular degeneration. It's a very slow form. And there's wet macular degeneration, which accounts for the remainder, which is a much more rapidly progressive form. What macular degeneration does is dry macular degeneration slowly thins the sensory retina tissue. Okay. And so as we lose that retina tissue, the quality of our vision degenerates with it or is reduced until it thins so much that it's no longer there. Okay?
All right.
With wet macular degeneration, it's a completely different type of thing. It is the development of abnormal, very fragile blood vessels into the retina. And those blood vessels frequently leak, and the blood is somewhat toxic to the retina when it leaks. And then when those blood vessels break, there's a large amount of blood, and that causes profound vision loss.
Okay, let's talk about some of the signs, because I guess depending on whether you have dry or wet, the symptoms are a little different.
They're a little bit different. So the symptoms of dry macular degeneration are actually very common to those of cataracts. So the patients may experience difficulty with the clarity of both distance and near vision, and that's common with cataract. What's a little bit different, though, is that with advanced or advancing macular degeneration, patients may experience difficulty going from a bright room to a dark room, and that adaptation becomes pronounced. And then in a more advanced phase, patients may lose central vision. So the faces may appear quite blurry, difficulty reading.
Okay, and then with wet macular degeneration, you might see a big old spot right in the middle.
Right, usually sudden type of thing. So you wake up one morning or you're walking down the street and all of a sudden you notice a big gray spot in your vision. Maybe not right smack in the center of vision, but you notice it. And then also more suddenly you'll notice a big difference between the quality of the visions between the two eyes. Or you may wake up and realize that you can't really see out of one eye. And these are much more rapid type of things.
Okay. The bad news, as Dr. Block said, this is irreversible, but that's not to say there's nothing that can be done. We want to try to prevent it.
Correct. So the most important thing is, what are the risk factors? So the risk factors for macular degeneration, unfortunately, the greatest risk factor is family history or hereditary. Up to 40% risk of developing macular degeneration if you have a parent, sibling, or grandparent with macular degeneration. Second greatest risk factor is smoking. Again, up to about a 40% risk of developing macular degeneration if you're an active smoker. If you stop smoking, after 20 years, your risk goes back down to the regular population. Then there's a bunch of lower risk factors, which are obesity, cardiovascular disease, such as coronary artery disease or heart disease, cholesterol, and hypertension.
Okay. And what we can do about it is more or less healthy, clean living, right?
Healthy, clean living has got to be it. If stopping smoking, if the lung cancer risk, the throat cancer risk, the heart disease risk hasn't gotten you, going blind has got to top all of those in terms of not being able to see while you have those illnesses. So stopping smoking, again, is the biggest one identifiable risk factor. We believe that wearing UV protective eyewear is very helpful. Okay. Of course, having a regular eye exam so that you can be diagnosed is helpful. There are studies that show that supplemental fish oil reduces the risk of developing macular degeneration. So 1,000 milligrams of fish oil supplement a day, or eating fish 3 times a week will help reduce macular degeneration. And green leafy vegetables.
Okay.
So your spinach, your kale, things like colored vegetables, colored peppers, carrots, all of those have bionutrients in them that are found in high concentration in the macular area of the retina, and they help that prevent it.
Okay, there you have it. That's good. You don't have to do anything you shouldn't be doing already. Dr. Block, thank you so much for enlightening us.
Pleasure. Thank you for allowing me to come and tell everybody about this very serious illness.
Okay, glad to have you here. And still ahead on Fox 61's Good Day Connecticut, it is Social Media Week, a good time to raise some awareness. We're going to talk with Howard Schwartz from the Better Business Bureau for his advice about staying safe while being social. Stay with us.